Good evening. Welcome. My name is Elizabeth Pedersen, and I'm with Cook County Health. Thanks for joining us this evening. If you need help with an appointment or any medical questions, you can reach out to our health system at 312-864-0200. Again, that number is 312-864-0200. Tonight we have with us our guest speaker, Dr. Mark Loafman, Chair of Family and Community Medicine. Welcome, Dr. Loafman.
Hey, great to be here. Thanks, Elizabeth.
Thank you. So as you know, it's August and it's back to school season. So before we get into that subject matter, tell us a little bit about what you do for Cook County Health.
I've got a great job. I'm a family physician at Cook County Health, and I'm also department chair for family and community medicine. So that combined role is awesome. I get to actually continue taking care of patients, some of whom I've had in my practice for years, and also help the system as it achieves kind of public health goals. So family medicine is on the front line of the public health and health system goals of of community health, and it's a great opportunity. I love the job.
Excellent. How did you get interested in this line of work?
You know, in medical school, we're exposed to all the different specialties, and I really like them all. And so that's what people say, that's the ideal family doctor. You kind of like everything about medicine. But I really like family medicine is on the front line. So primary care is really the first responder. It's who people think of as their doctor. And when I had a chance to experience family medicine, both as a patient growing up, but also as a medical student, I realized that's really what I thought of when I wanted to be a physician. So for me, it's great. And having that chance to have long-term relationships and also meeting people for the first time as they're entering the health system, helping kind of navigate, getting to know where they should go, should they need initial help, or can we be reassuring, having a health plan for over time, and then lastly being part of a medical home, kind of a place where we leave a light on for you as a patient to come in. I was sold. I wanted to do that and went on and did a specialty residency in that and a fellowship in maternal child health, and have been practicing in the Chicago area for about 25 years.
Excellent. What do you enjoy most about your job as a physician at Cook County Health?
Yeah, it's almost always patients. I've always said I never have a bad day when I'm taking care of patients. I love that part of it. And the patients that we have the privilege to see at Cook County are just amazing. The stories, the diversity, the wisdom they bring, they teach me so much. But the patients and then the staff and the mission, I think you're combining that. We're kind of all on the same page. There's no question why we're here. We're not a for-profit system. We're here for the goals of the county and our patients. And I think that combination is just amazing. So it's quite an opportunity. I feel blessed to have the privilege to be able to do this work.
Excellent. Thank you for sharing. Like I said at the beginning, it's back to school season. Some children have already started back to school.
Mm-hmm.
The Chicago public school system will start after Labor Day. As parents are getting ready to go back to school, we're encouraging them to make sure they get in to see their providers.
Right.
What's required of children these days when they go back to school?
Well, there's a form that has to be filled out, and that's what most people are familiar with, but there's a lot of important information that happens at that visit. So it's an opportunity really to check in on the overall health and wellness of the child. And it's the school's way of kind of ensuring that child comes ready to learn, that they're safe, that any health issues are being addressed. If there's special needs that might need to happen at school, that those are going to be addressed, that the child's not going to be a risk to others in terms of communicable diseases with infection and that sort of thing. And it's just, I think, part of the responsibility of the system. You want to kind of an academic wellness, we talk about it, that you're ready to be able to engage in school and participate as a good team player, safe for yourself, ready to learn. So there's a lot that goes on there. In the visit, it gets condensed sometimes because we're trying to get the vaccines done and some of the screening done. But it's part of an overall primary care plan that really outlines sort of the main topics, and that's what the form is for, to validate that we have done those things and the child is ready to engage in school.
Excellent. So speaking a little bit more to that, what would you say to parents? Why is it so important for children to make sure that they get in, get their physicals, get their immunizations done? if parents needed to know what was the bottom line, what would you tell them?
Yeah, I mean, I think we all kind of want that coach and somebody that's got an eye out to sort of keep an eye on things. So parents are great. They're obviously the most important source of support in the child's life. But it's how much do we, or how are we able to manage all those extra health issues? So it's an opportunity to do screening for some really high risk and important behaviors and activities and conditions that we can treat. And it's things that may not come to the parents' attention until it's more advanced or late. So the screening aspect is awesome. It's also, there's an old saying, it takes a village to raise a child, and I think we know that's true. And our medical homes are really an important part of that village. So, and having a trusting relationship and another source of strength and support, we often find we're reinforcing messages that the parent's been harping on for some time. We're able to say it as this third party, this objective person who's really coaching and supporting. So I find so often that the parents nodding their head as I'm talking to the child or answering some of the questions that they appreciate having that extra support. We always make an effort to align our message with the parents' goals because there's almost always are aligned. And so that's another piece of this, to have that value. We touch on academic wellness and school performance and healthy behaviors and other things that we know our parents are interested in. So it's just an additional sense of support. And then over time, and I think, hopefully we'll get a chance to talk about this more, but I think over time to have the child begin to become more independent in their relationship with their medical home is a great stepping stone, and having the parent endorse that and support that and show that as an important aspect is really vital. Yeah.
Great. So can you speak a little bit more about what are some of the more common issues you see children coming in today as far as diseases and conditions? What is most prevalent right now in the practice?
We kind of lump them into some categories. So there's obviously physical conditions, so asthma, eczema, skin conditions, headaches. Children have a lot of the same things that adults suffer in indigestion, anxiety, school phobia, being the victim of bullying behaviors and their own discovery of trying to figure out who they are and the angst around that. So there's a whole lot around the physical and psycho-emotional piece that we screen for and talk to about and create a safe place for the child to talk about that and hopefully help the parents have some language they can use for the child around that. So there's a lot there, and I think it's almost more common than not that children have some anxiety, something they're dealing with. It could be the stress of their relationships. It might be their own identity and who they are and how they're being fitting in with their peers, school performance and the pressure on that, the safety they may feel in their community, questions about their weight. Is it healthy? Is it too much, too little, and their diet? Engaging in sports, other symptoms there and activities. So there's just a lot there. And so what we do is kind of triage those things to see the ones that are priority and use the school physical time to get at that. It's often not the only time we want to see the child, but it's one to get at that. So those are the common things. And then, of course, there's some catch-up things that we'll find. So there may be catch-up vaccinations or things that we want to do to catch up, or indicated things that are due at that time, some health screenings that are there. And then, safety is such an important topic that children are more likely to be injured than they are to be harmed from an illness at the age group, and so being able to screen for that and address some of the safety risks that parents are obviously thinking about, but again, it's that other source of support, somebody else who can reinforce the need for safety, anything from wearing a bike helmet or wrist guards to practicing safe activities and avoiding risky behaviors with drugs and alcohol, etc. All those things are there. So we triage for that to try to see what fits best at that visit for the child and the parent and what's going on for them. So the screening is happening for everybody, but then based on that screening and based on the age, what's going on, what the history's been, then we can begin to tailor that around it.
Yes, I know there's been some articles, obviously we've seen this for quite some time, but on social media and the internet. When I was growing up, we played outside.
Right.
We didn't have that component. Are you seeing kids with a lot more anxiety and safety concerns and more issues with bullying in your practice, especially as back to school season's kind of kicking in? We've had some kind of, unfortunate events happen over the summer.
I think that there's always been things for kids to be anxious about, and there's always been bullying and safety concerns. But I think it's the scale is incredible now. I mean, the awareness of what children are exposed to, what they see, And so it's taken on a level that creates some concern. So I think having healthy conversations around that, we can't insulate our children from witnessing these, but we can certainly help them learn how to manage it, and that's the most important thing we can have. So I think we can create and give some guidance on how to have conversations, how to control what children are exposed to, some accountability for that too. We used to harp on trying to limit screen time, and I think it's almost like a lost cause. It's really hard to limit screen time, but I think we can help a lot with how to set some boundaries around it and some safe access to it and some monitored surveillance and just some simple rules. And again, having the primary care team reinforce what the parent's saying is we want you to have some control around what you're exposed to. Then just being able to talk about it and understand that having a child feel a sense of safety and security is huge. And we know that that's not always the case. It's not necessarily there. So parents, I think, struggle with that, and we know that. We see it, and we want to be a source of support for them. And we have psychological support and other services we can provide too. So again, a chance to screen for those things, talk about them, set some boundaries around it, and then create opportunities for follow-up visits and then some referrals to resources as we need to help parents navigate that treacherous area, I think, of just so much that kids are exposed to. And we'll see children almost at early elementary age that are playing on an iPad and having somewhat unlimited access to what they click on in YouTube and that sort of thing. And parents aren't necessarily equipped to navigate that. So we do help create some guidance around how to handle that. And then again, if things have come up and there's been exposures, how do we have a healthy conversation around managing that anxiety so kids can go to sleep at night and feel rested and feel relatively safe and ready to go to school and learn the next day?
Yeah. Now, in back-to-school physicals and the appointments,
Right.
does Cook County Health offer services for behavioral issues that you often recommend for children so that they can maybe see someone for counseling once a week or get evaluated additionally?
It's a great question, and the answer is yes. I mean, I think we've found that there's such a strong need. It's been estimated that 80% of children's health needs are psychobehavioral and only 20% are medical, so we need to build that capacity. And we've been engaged in a build-out over the last few years at Cook County to add dozens, I think, scores of new behavioral health staff, and not just as a referral, but embedded right in our clinics. So we have licensed clinical social workers and medical social workers who can help with that, and not just to fill out forms and do referrals, but to actually sit and do some counseling, some behavioral therapy. And again, we always want to reinforce we're helping children to manage their anxieties and make healthy decisions and choices, and reinforcing what the parent is. Maybe a different message, a different approach, but it's always the same goal, to help the child be safe and independent. So I think that we study and look at the amount of what we call adverse childhood events, or even so-called toxic stress that our children are under, and it's almost more common than not that kids at some point in their school age years will experience toxic levels of stress, and this is a amount of anxiety and fear and concern that just supersedes what would be routine. So again, most children have anxiety about things. We all learn to worry about things, but the level that our kids are experiencing today, for all the reasons you mentioned, and just sometimes what's going on at home and in the community, it's intense, and it affects health. It affects their ability to learn and grow and future health. So we're really, really committed to identifying that, screening for it, and then being able to set up opportunities for follow-up, as you said. And I think what we're kind of learning is, we grew up. I certainly did. Suck it up and get back out there. And you're going to be fine. Don't worry about it. And I think those kind of messages maybe helped with the routine stuff, but they're not helping with this deeper level of so-called toxic stress. So, but it does help to have a therapeutic place to talk about it. So we are committed to that. We do have that capacity there. I don't think any of our centers now would come up short when it comes to that. And we're proud to offer it. I think it's just a very important part of the future.
Yes, no, agree. There's a lot of studies out about that now.
Mm-hmm.
I know, obviously, you treat obviously younger children, and then as they grow into adolescence, obviously they have different needs with their back to school
Yes.
physical. Talk a little bit about how that gets a little bit different as they get older, and obviously they're exposed to more, and kind of
Right.
what that looks like as opposed to someone who is maybe in elementary school, who's maybe less affected by peer pressures.
Right.
As adolescent age specifically.
It's a great question, and it's awesome as a family physician to watch that transition happen, to go from an infant that we're holding and the parents providing 24/7 total care for, to now then a young adult who hopefully will check in and get some advice from the parent once in a while, but that's really on their own. So that transition happens through adolescence. It doesn't happen one day. But it happens over time, and it's not. There's no guidebook for the kids don't come with a instruction manual of how they're going to individually handle that. So we do find that to be an awesome time. It's also an area of conflict. So 1 year the child's there and the parent's in the room for the entire visit and has total control. The next year the age triggers the need to have a confidential visit with the child, and so hopefully we've had a chance to prepare the parent for that. It's sometimes an anxiety-provoking thing when we ask them to step out. We're required to do that, to have some confidential time and to discuss it. But it's a good thing to do, and I think we want our parents to feel comfortable that they don't have to be concerned what's going to happen in that room. But there are children who are going through things that they haven't quite figured out how to talk to their parents about it yet. And we help them do that, but as part of that we do that screening too. So that transition from parent total control to parent very little or almost no control is a years-long process. That's adolescence, and sometimes I think we find the medical home and the primary care system is a great place to help navigate that, because we can have those conversations. So we try to first have them together with the parent in the room, and then eventually having the child alone to be able to have the conversations. And we talk about safety, we talk about drugs, we talk about gang activity and violence, and also sexuality and where the child is. And we're really, I think we found what works best is to be open, to let the child tell us the truth, what they're really experiencing, without judgment, but out of a sense of concern often. So if we find there's risk-taking behavior happening, we share concern about that, just like we would if there was an anemia or any other condition, or a depression or a heart murmur, the same kind of thing. We're going to show concern for that. And it's pretty effective. It's pretty effective. The child then understands this is a place I can go, I can get good advice, I can get non-judgment but support, and then mirroring that back from the parent. We always encourage the child to talk to the parent, and of course we're obligated to share that information. If the child's doing something that's a risk to themselves or others, we're going to report that. So parents can feel safe that anything of that nature is going to get reported and be found out. But it's really important for the parents to trust and let go and let the child start to have an independent relationship with their provider, because that's the best training for them. They don't wake up at 18 all of a sudden and become autonomous adults. It's great for that transition to happen over years. And we, again, will reinforce the safety and concern, and let the child know that the best way to get their independence is to give the parent plenty of reason to trust them. We say trust comes from, good behavior over time. It's not a one-time thing. So we're always reinforcing what the parent's concerned about with our own messaging about it, and in a way that we hope will build that relationship with the child over time. But the bottom line, parents, is let that go. Be comfortable with that. Take advantage of that support you have from the healthcare team that's stepping in, trying to help, and know that we are supporting you in your role always. That's always our job.
Yeah. Do you find that children are much more inclined to speak with the primary care provider as opposed to a parent? Do you find that children open up a little bit more with a medical
varies.
professional?
It totally varies, and I think every parent-child have developed their own relationship, and I see the full spectrum from children who I just saw an adolescent in clinic yesterday, an older adolescent who I was sure wanted to kick her mother out of the room, and no, didn't want her to leave, wasn't going to have her leave, and amazing ability to have a serious conversation about some very sensitive topics, and the parent was very supportive about it, and open and not judgmental. And not right or wrong, that's just one example. Then you see the opposite, where the child's not going to say a word until the parent steps out. And so we don't judge that, we just assess it and go with it. And I think, again, it's not right or wrong. Parents have their way, but we will navigate either version of that.
Okay. I know one of the other big components in health topics with the last year with some measles cases reported are vaccinations.
Right.
So talk to us a little bit about that, Dr. Loafman.
Well, there's a lot out there, and with the internet and any other advocacy effort, there's information that's helpful and there's information that's not, and it's really treacherous. We feel the pain of parents trying to navigate all this. So, I think most importantly, vaccines are safe and effective, and I think that's the message that we always say. And at some point, you have to make a decision: do you believe that or not? And if you do, we suggest you should. And I will add, I think. I'm impressed with how many of the parents in our system in the Cook County Health are very supportive, and so we really have a lot of support from our parents to get our children vaccinated, which is fantastic. But they're safe and effective, and I think it's reasonable to question. But what we always say is be careful picking and choosing which ones you want and which ones you don't, because you begin to disrupt the whole thing, and I think that's the most important. So if you accept vaccination, and it's been around a long time, it's a safe practice. Incredibly amount of studying and surveillance goes on with the recommendation, and very quick to take action if there ever is any concern. But we do best to get them and get them on time and stay on schedule. And again, we always respect the parents' right to choose what's best for their children, but this is an area that I think parents have just been exposed to so much misinformation about it that it's just difficult. And so we have resources, some of the best, most researched sites and recommendations. That's what we follow. We can direct parents there too. But by and large, we're best off and healthiest when we vaccinate on time. And that's really an important message. And I think physicians, nurses, those of us in healthcare, 100% support that message. And I think that should create a lot of confidence for our parents when they're making these decisions.
Yeah, so how do you keep patients on schedule? Because I know some patients may get off or maybe they had issues with their health insurance. How is it that you kind of keep people on track or get them up to speed if they've fallen behind?
We struggle with this. It's a great question. I mean, it always works if the next visit's kept, if there's a missed appointment or the appointment's too far out to schedule it. I think that's a challenge. So what we're actually experimenting with some different techniques, communication techniques. So parents may not know this, but they can be the proxy portal. In other words, they can connect to the health record for their child between birth and age 12, and they can do that. So that's a great way. So then we can communicate online and through email and confidentially and schedule a visit. We're also getting better about anticipating. So this is today, here's what's next. So at age 1, at age 15 months, at age 4, for example, we have specific times. So I think when parents understand what's next, they're going to be good. They don't want to wait until the school's notifying them that the child's out of school because they're behind. So it's a shared activity. The parents have some responsibility and an opportunity, and we do too. And we're kind of learning from what works and trying to get better about anticipating. Part of the leaving the clinic today is you're all good now, but 3 months from now there's something else, or a year from now there's something else. And so let's stay together on that and communicate about how to get back in and get on time. Because a delay in vaccine can be just as dangerous as not vaccinating, so you miss that window.
Excellent. I guess as we wrap up the show, speak to how parents can kind of keep involved and any other tips you have for parents and children as they head back to school.
Yeah, thanks for that. It's a great question, and kind of what we talk about is healthy relationship, just building and maintaining healthy relationship with your children. So, discipline is best as an education process, and so helping the child be aware and that nurturing love and support that only parents can provide. So I think having that there, having some plans and goal setting around school. So what are the goals for school, the academic goals? And I don't just mean a good report card. We want that, but study time and other activities and nutrition for health and sleeping, and how to reinforce that in terms of helping the child prepare to be a responsible adult when they get out there. It shouldn't be a source of contention. It shouldn't be something there's threats and punishment about. It should be more of a shared goal setting with parents and kids. And I think that whole sense of, again, we call it academic wellness. There's an overall sense of a child that's healthy, ready, engaged in school. That's what we're looking for, and we just want to help do that as part of the medical home.
Excellent. Well, thank you so much for your time tonight, Dr. Loafman. We are glad you could join us on the show.
Great to be here.
Look forward to having you back in the future.
Thank you. Great to be here.
Audience, if you have any questions or would like to find a physician, please go ahead and call our number. That number is 312 312-864-0200. Again, 312-864-0200. Thank you for joining us tonight, and Dr. Loafman, thank you.
My pleasure.
Good night.
Good night.